Did you just lose a tooth? What should you do? Hi, I'm Dr. Myrna Lazaga here in San Diego, California. We get a lot of questions regarding dentures. So today we're going to answer those most common questions so you have better understanding of what a denture is. Dentures are appliance that we use to replace a missing tooth or teeth that will help you the rest of the other teeth that's still there get stable. The type of dental professional that do dentures, most general dentists does make or dentures. And then the other specialty is what we call prosthodontist. A dentist will recommend getting a dentures if you're missing a tooth or more teeth missing. And then also you can get a denture in transition of replacing a tooth with implant. There are a lot alternatives of dentures. It depends on how many teeth you still have in there. Now, the options is if you lose all your teeth on the top, then you'll need a full denture. But if you have a tooth besides it, you have an option of fixed bridge. If you do have only few of the teeth, there's nothing on the other side to connect it, then you will have what we call partial denture. The alternative to dentures, there's a lot of options. It depends on how many missing tooth or teeth you have. If you only miss one tooth, there is an implant as an option to replace that missing tooth. If you do have a tooth that has also a tooth next to it that we can connect it to, then you can have a fixed bridge. Now, if you have a tooth as well that you only have the front ones, then you can have a partial denture. There are different types of denture. One is a complete denture. A complete denture is like this. When you're missing all of your teeth on the top, this is an upper denture. Then we use what we call full denture. It's usually a removable. And then the other one, if you still have few teeth remaining that we can hold on to, then you can end up with what we call this partial denture. Now, there's also, these are the removable part. There is also what we call fixed ones, wherein you have a fixed bridge where we can connect it to the tooth next to it, and it does not, it stays in your mouth and it permanently. And then the other one is when you have a denture that's implant supported, that's fixed. We screw it in. You cannot remove it yourself, but your dentist can remove it, and it's considered fixed denture. Dentures are made, of course, custom fit to your mouth. The removable one, like this, is acrylic, and there's this one as well that are flexible. It's made of thermoplastic. And then the other one that's a fixed one, it could be porcelain or zirconia. How are they made? Of course, we take an impression of your mouth, and then we send it to the lab for the lab to help us fabricate it. During a denture placement procedure, we will make sure that the denture fits snugly, and that when it's in your mouth, we'll let you bite down. Make sure bite is okay and nothing hurts. That's very important. If there's any area that hurts, we need to adjust it and relieve that sore area. When I make a denture to our patient, I promise them there will be no pain when they have their denture, because that's two different things, getting used to it. Because getting used to it, it's up to the patient. So that's the most important, the two different, because sometimes folks, when they get dentures, they're not ready to transition yet, especially those that's gonna need a full denture. That's why it's really important that I let them know that there should be no pain. But for them to get used to it, I cannot promise that because that's two different things. Getting dentures should not be painful. I do believe, because I heard this from some of my patients, that they've been to another office, they had their denture made, and they come to my office and I adjusted it. And one comment they said that, oh, the other office said that just get used to it. I don't believe that you'll get used to it when there's pain. So I promise my patient that they don't leave my office with pain. So that there should not be any pain with their denture, because I believe you will not get used to it, your denture, if there's pain. During the denture procedure, it depends. If it's just removable, I don't need to anesthetize you, because I'd like to check your bite, so that way when you're numb, sometimes your bite changes. Then we just sit the denture. That way you also feel if there's areas there that hurts while you're still at the office, and we can adjust it. Now, the other thing is when you have a fixed bridge, then sometimes we have to numb you up if you um, sensitive on that area. But most of the time, I usually don't use anesthetic during the insertion of dentures, so that way you can sense better any areas that's discomfort or pain. We strive that your denture look natural, that it matches your facial profile, and that you like the color, and then you like the shape of the teeth. And then if you have a tooth that's like on the front, we try to match it to the tooth next to it by color, by the shape, and by the size. So that way, when you have it in your mouth, it looks natural on you. The denture would feel like your one is if it's a fixed one, you would feel it's becomes easy and adjusted as a normal tooth in there. But if it's removable, you would have some adjustments. Um, let's say, for example, if you have a full denture, full denture stays in your mouth by suction. So you have to learn how to um, make it fit, because by suction, by we call it suck on a sour lemon, like that, because through suction. And then also how you're going to enunciate those times. But during the try-in, I let you, say words while it's still in wax. The gums is still in wax. So that way we can tell if we have the right length of the tooth, and that also when you smile that there's teeth showing. It can be difficult to speak when it's just your first time to have your dentures, but it will easily go used to it later. But it takes adjustments, and sometimes I have to make sure that the patient is ready to transition to that, because you have to learn how to speak. And even when you have it denture already, you also have to start eating some soft diet before you get into corn on the cob. The ability to eat, not necessarily, in the sense that we try to adjust your bite, but of course, there is no better teeth than your own natural teeth. Denture is a replacement, but not exactly replacing your natural teeth. To clean it is better when after every meal, because if it's removable, you have to take it out and brush it like you brush your own teeth. Now, when if it's a fixed one, like the fixed bridge or implant, I highly recommend that you use a water pick. The one thing that I would recommend when you just have a denture is when you take out your dentures, if it's a removable one, rinse with warm salt and water. 1 teaspoon of salt to a cup of warm water. That will help your gums heal if there's some sore spot in there. Now, if it's a fixed one, you also same thing. You have to rinse with warm salt water if the areas somehow get irritated from you cleaning it, or from any pressure that's we just relieve any sore spot. Dentures last, it depends on how you take care of it. When you lose another tooth or teeth, your denture might need a new one or might be repaired. There are times when we can still repair, add on a tooth on an existing denture. But if it's your denture is already loose and it's been broken down, that beyond repair, of course, you're gonna need a new denture. And normally it lasts around, like I said, depends on how you take care of it. 5 years average. When you have a denture, let's say, for example, you have partial, and that certain tooth wherein it holds the clasp or the denture and you need a crown. Definitely, you're gonna need the crown to fit it to your partial. What we usually do is we borrow your denture along when we send the case to the lab so that they can customize, fit it to your denture, your new crown. When your denture needs replacement, it depends. Let's say, for example, like you lose a tooth, and then there are times where we can add on the tooth on your existing denture. If your denture, like with the full denture, like this, because your gums might shrink and your denture is loose, then we can do what we call reline to make it more tighter. It depends on how your acceptance is, in the sense that as long as there's no pain, I think it's easier. It'll take, in some cases, my patient, I would just tell them get it in couple of days to slowly transition from soft diet to solid ones that's soft, and then before they can become dentures. Cost, it varies what kind of denture you have. Most insurances, they cover like 50%, but there are some insurances wherein they won't cover because there is what they call prior extraction clauses. So it depends. It's better to check with your dentist as far as your insurance coverage is. Anytime you can schedule an appointment for denture. My suggestion, if you think that you have a loose tooth, I would normally would ask you to come to the office, because especially when we have to end up taking a tooth out, we can do it wherein we process your denture before we even take the tooth out. So the sooner that you make an appointment, because it takes time to make a denture. It's not that we take an impression and tomorrow you get it. No, that's not the case. There's a process to it. We do a try-in, make sure that, and then we do what we call bite, how your teeth on the top and bottom matches. So those the kind of procedure that we do prior to giving you the final denture. We try to get all the answers possible that we receive, and if you have any additional questions, please feel free to call our office at 619-477-0570. Thank you.